I was diagnosed with breast cancer after a regular mammogram screening in January of 2013. I was super fortunate enough to be referred to a fabulous physician, at which point he, after discussing all my options, decided that he wanted to get in and do a lumpectomy first and see really what was going on inside my breast. So went through a lumpectomy. You wish for the best, but sort of prepare for the worst. I got the worst, got the call back, but the call back was not quite so scary because I believed and I had a lot of knowledge about what was going to be afforded to me about my treatment. I went back in for my mastectomy, but prior to my mastectomy, my surgeon said to me, have you thought about reconstruction? And I was like, you're dealing with so much, unless somebody tells you, have you thought about reconstruction? I honestly don't think I would have thought about it. So I thank my doctor every day for bringing it up so early and referring me out to another incredible surgeon who, the two of them really tag team for me. And we came up with a plan for my mastectomy, planning on reconstruction afterwards. And it makes me really sad to think that some women do not get that knowledge of what is available to them. I really feel like every woman should at least have the knowledge about what the choices are that have to do with their body when they're faced with breast cancer. I wasn't 100% sure about what my decision was going to be until after I had my mastectomy, and I had a spacer put in. I had a Metaport put in for my chemo, and then I was healing after my mastectomy, going through my chemo treatment, continuously talking to my doctor about what I thought was right for me. So I listened to my body, and my body told me what would be the best option for me. That option was a DIEP flap. So Dr. Zeidler marked tissue in my abdomen that had incredible blood flow, transferred it to my breast, and I think it was like 8 or 10 hours of microsurgery, reconnecting all the blood vessels. I stayed in the hospital for 3 days, making sure that the tissue was living. I will say that everything went perfectly for me. There are a lot of risks with everything, but I listened to every single thing my doctor said. I followed her instructions to the T, and I was really lucky because everything worked perfectly. I would just like to tell women that be informed. I feel like information helps you to make a good decision. Doesn't matter what the decision is, but when you are informed and you have all the facts, you're going to be able to make a decision that is going to work with you, and you're going to be able to live with the decision that you make.